Tunisia is facing its worst COVID surge since the pandemic began, placing further stress on the North African nation's already crowded hospitals and health system. It's forcing some regions to go back into lockdown and prompting waves of donations of vaccines or medical aid from countries such as France and China. Let's cross now to Claire Paccalin in Tunis. Claire, just how bad is the situation at the moment?
As bad as it's ever been, Annette. Tunisia is widely seen to have successfully managed the first wave of COVID-19 back in March 2020 because it locked down its population quickly. Now, though, we're looking at over 7,000 new cases a day, and on average last week, 177 deaths per day. It's never been as bad as that since the pandemic began. We actually visited a public hospital here in the capital, Tunis, and it was a chaotic scene inside. We spoke to doctors who said that they were completely overwhelmed. We went into a room which has 15 beds in it, usually in the emergency department, but there were 40 beds crammed into it with mostly elderly people in there fighting for their lives. We spoke to one doctor who had just finished a 24-hour shift and she was absolutely exhausted, and she told us that she had to make very difficult decisions about who to treat because she's running out of oxygen. Now, some good news is that oxygen has now arrived as a donation from France, Italy and Algeria, and so in the next few days that will be distributed as fast as possible to hospitals around the country. So hopefully that will take some stress off the situation at the moment.
And Claire, what is the government doing to combat this crisis?
Well, the government has put in some place lockdown measures. So Tunisians are not supposed to travel within the country, and there is a nightly curfew in place. A measure which it's trying to get in place, and it announced yesterday, is that it wants private clinics to share the burden when it comes to the COVID-19 crisis. It's demanding that they take on patients and they play their part. Now, that's easier said than done, as obviously private clinics are used to charging their patients often substantial sums of money for treatment. So who's going to pay for that? In addition, some private clinics are not necessarily equipped to put in place a COVID-19 service. They don't have the personnel, or they might not have the material in place. So it'll be interesting to see over the next few days how that measure will develop. In addition, it's worth noting that Eid celebrations begin tomorrow, so social distancing measures could be put at risk as families get together to celebrate.
Claire Paccalin reporting there from the Tunisian capital. Thank you.